Barrett's esophagus is a disease that it's actually a changing of the cells or the cell lining of the internal lining of the esophagus, usually caused by refluxes or acid coming up. And sometimes people can feel that acid come up into their esophagus and sometimes they can't. It's what we call intestinal metaplasia, or a changing of those cells from one type of cell to the other. And your body's doing that on purpose in order to try to better combat that acid. It's changing them to somewhat of stomach cells where the acid production is higher. But what we've found is in a very small portion of that population that can actually lead to an increased risk for cancer. What I can do is I can treat that disease process endoscopically with a scope down the throat and into the esophagus, and there's different techniques that you can do. You can take large biopsies of the area and slough off some of that mucosal lining to help it reheal. The other thing you can do is do what we call radiofrequency ablation on those areas to burn the lining of the esophagus to help those cells rejuvenate and help kill those dysplastic cells before they get worse and become more worrisome for cancer. Barrett's esophagus is not necessarily always a huge precursor to cancer. A lot of people end up having some metaplasia, and it just needs to be followed closely every 3 to 5 years or so. And so not all of Barrett's needs to be treated with any endoscopic techniques other than just surveilling it with scopes down the throat to look at it every 3 to 5 years. If it's more worrisome, then maybe every 1 to 2 years.